right, so thank you everybody for coming. I know most everybody, but some people I only know by Zoom, so thank you for coming. I'm Tina Ramirez, and I'm the Director for Great Rivers Regional System for Addiction Care and Marshall Health. And I am the Board President for the Regional Family Resource Network, which is where Putnam Wellness Coalition is housed. So we were able to put this on today. We kept hearing so much about Xylazine and everything that's going on, but we felt like it wasn't really getting down to all the QRTs and everybody in the community that were boots on the ground. So we asked both Dr. Hoskins to come in and kind of give us an update as to what's going on, what we should be looking for, how can we educate other people in the community. So I'm going to just do a little bit of a bio for both of them and then introduce them to come up and just kind of walk through everything that's going on. Then we can have question and answers afterwards, because I know you quick response teams are already seeing it in West Virginia, and I'm sure you have a lot of questions for them as well. So restrooms are around the corner if you haven't found those already, and help yourself to food and everything over there at the table as well. So I'm going to start with Mary, Dr. Mary Haas. She's a graduate from Albany Medical College. She has a BC in Addiction Science, a BC in Orthopod. She's fellowship trained trauma surgeon, and she's associate professor for the West Virginia School of Osteopathic Medicine. Dr. Harry Haas is a medical director and owner of Dr. Haas and Associates, has been practicing MAT and MOUD since 2007. He's has a board certification in addiction medicine and family medicine, and he's certified medical review officer. So that's a lot of information to share with everybody today, and I think he's made rounds to all the tables to talk to you folks, but he's going to give you some updates, the latest updates, and then Mary's going to come up and talk about the wounds and the different things that is out there in the community as well. And then just let Miles know we need to advance the slides.
Hey Miles, I guess we can go to the next slide, please. Okay, here's just my
I think you might need the mic, please.
These are my disclosures. I teach and do consults for the Opioid Response Network, and they're helpful because they'll actually come down to your facility. They'll talk to you by phone, by email, by Zoom, and help you set up programs to treat people with opioid use disorder or meth use disorder. I also teach for ACM as well as PCSS. PCSS has a lot of great videos, and they're normally all free. I also teach for the Danny Institute, and I have my own practice in Western Pennsylvania. Next, please. This is just my sister, who's in West Virginia School of Medicine, Osteopathic Medicine, Associate Professor. Okay. A lot of these slides came from ASAM and the Addiction Technology Transfer Center, which is part of the Danny Institute. Okay, we just want to talk about some objectives. We'll try to be general. You know, so many of these drugs over the years, particularly opioids, have had contamination in them with different things. Sometimes by mistake, sometimes on purpose. We're going to talk about pharmacology and toxicology and diagnostic testing, and that's a real problem because most facilities don't do diagnostic testing for Xylazine. And even if you do use the test strips, there's a Canadian company that makes, one of the Canadian companies that makes the fentanyl test strip. They also make a Xylazine test strip that they just started selling in America about a month ago, 2 months ago. It's about $200 for 100 test strips. But the problem is the test strip is positive or negative. It's like a pregnancy test. You don't know if you're 6 weeks pregnant or 26 weeks pregnant. So, and like I said, a lot of places haven't even been doing this testing. They don't have that capability in their hospital. So they have to send it off to a lab, and that takes days. Okay. So we're going to talk about cutting agents. And cutting agents have been used for different reasons. Sometimes just to bulk them up. That's like when you saw the movies, the old days, when the heroin was white, and the man sticks his finger literally into it and tastes it. Do you know what she's doing? Anybody? Yes. What what's he tasting for? They normally cut that white stuff with powdered sugar. So if it's real sweet, she'd think, well, he or she thinks, that's not very good heroin. But if it's bitter, and all opiates are bitter, then they assume that's mostly heroin. So that was one thing that was done, one way things were cut. But things have been cut for other reasons too. Sometimes they're cut to enhance the effect of the drug. And that's what we think might be happening with xylazine. Also, cocaine has been cut with many different things, such as caffeine. Excuse me, the last one there is Benadryl. You also have your lidocaine has been cut with, because it's a numbing agent, so people might think that two are the same until you don't get a high from it. And then heroin has been cut with many things. Fentanyl, caffeine, quinine, aspirin, acetaminophen, scopolamine, okay? And now today, what we thought was heroin is normally 100% or 99% fentanyl. And now that fentanyl is being cut with xylazine. Next, please. Okay, here's just a list, and this is why, if you have a needle exchange program, you want to get people into treatment with medication, because eventually they're going to get something in that needle that's bad for them. And here are some examples. Back in 1983 and 84, I was in med school. There were people that took heroin and was contaminated, and they got permanent Parkinson's disease. Then this happened, Allegheny County is greater Pittsburgh. The heroin was contaminated with a strong fentanyl, and many people died. Okay, then you had scopolamine poisoning, that was in the heroin from New York, all the way down to Baltimore. You've had other contaminations, fentanyl contamination, cocaine. That's still going on right now. You probably remember last year, it was on the national news, 7 or 8 people overdosed down in Fort Lauderdale, and 5 of them were West Point Academy cadets, and at least 1 died. And in 2 years, 12 people overdosed at one time in Pittsburgh from fentanyl in the cocaine. And just down from my office, 4 weeks ago, it's a really sad story. A young woman, she gets told, your breast cancer seems to be cured. Your PET scan's good, you're fine. So she and her 2 friends go out to celebrate. And they They take cocaine that has fentanyl in it, and then 2 of them died, and the other one's still in a coma. And I guess we'll talk about one that's specific to West Virginia. If any of you knew anything about the Panhandle, about a little over 4 years ago, the Panhandle, the heroin was all contaminated with feces. And so for 2.5 weeks, people came in with terrible skin infections. Some of the infections got into not just their muscles, but down to their bones. If you have a bone infection, you have to get treatment for a month or more, IV. People are kind of afraid to get IV, permanent IV PICC lines and portals into people that are using IV drugs. So that was a real problem. Other people had valvular disease from it, had to have heart valves replaced, and some poor souls died. Next, please. Okay. So we think, but we don't know, the fentanyl has xylazine in there to make the high longer. See, fentanyl is short acting, and xylazine is very long acting. Now this is just background. The xylazine was invented way back in 1962 by Bayer Corporation. And it came to America, and they asked for FDA approval to use it as a blood pressure medicine, because it's a alpha-2 adrenergic agonist. And one of the old blood pressure medicines in America, clonidine, have you ever heard it? It comes to the patch and it comes to the pill. That's an alpha-2 agonist. So they brought it to America, tried to get the FDA approved. The FDA said, no, we're not approving this. Everybody who takes it falls asleep for 48 hours, so no thank you, we're not going to approve it. And so nothing more happened for a while. But eventually, it was approved in 1970s for sedation in animals. Okay? as I mentioned, it was approved in 1872 for analgesic in animals and as a sedative in animals. And while we're here, in animals, there are reversal agents. There's actually FDA-approved reversal agents, Xylazine and Yohambi. But for some reason, no one has felt comfortable to try those animal reversal agents on humans. Okay. Next, please. There we go. Okay. Now, Xylazine actually has been around for a long time, being abused in some places. In Puerto Rico, it's been abused for almost 20 years. And down there, they have two names, what they call it. That's Spanish for crocodile. And it's also called just horse tranquilizer in Spanish. But also in the streets, it's called tranq and zombie drug or tranq dope. And though it's gotten here to West Virginia, it's still in low numbers here in West Virginia. It's still concentrated from New York City down through New Jersey, down to Philadelphia, down to Baltimore, and down to Washington. That still has the highest numbers. Okay, next please. Okay, this is just about how it was used in Puerto Rico for some time now. And you know, they question, there's case studies, they question people that took it, and they say they just fell asleep. And they fell asleep for 4 hours normally, but some fell asleep even up to 8 hours. And if you're not moving for 8 hours, you can have all kinds of other problems. You can get pressure ulcers. That's why in nursing homes they move people. You know, if you don't move your legs for 48 hours, you can get blood clots. Blood clots can go to your heart, your lungs, or your brain. So a lot of terrible things can happen when this makes you pass out for 4 to 8 hours in one position. Okay, next please. Okay, these are just how different ways the xylazine comes. And the xylazine is normally manufactured in China, and that's where it comes from. The DEA says that it really isn't manufactured in China. It's just the ingredients that make it are manufactured in China, and then come to America through Mexico. And many of you are adventurous. The gentleman who has the company that makes this and the precursors for fentanyl in China, there's a $30 million reward if you can capture and bring him back to America. But he has no intention of leaving China. Okay, next please. And this just shows you the concentration. Concentration, as I said, it starts up there at the edge of Connecticut, going through New York, down to New Jersey, Philadelphia, Baltimore, and so it's throughout the East Coast, but it's spreading. You see it now in Pennsylvania, you see it now in Ohio, you see it in West Virginia, but still at low numbers. Okay, next, please. Okay, and this just shows you the tremendous increase in the last couple of years. Now, everywhere, the numbers are soaring. Now, of course, part of that, you started with low numbers to begin with, but it is really significant. You're seeing this much more. Next, please. Okay. Now, this is something for your state. In 2019, 1% of overdose deaths had xylazine present. By 2020, that was 5%. But the people that were taking drugs with opiates with xylazine is a slightly different group. These are people that 98% of them was fentanyl, but they also were people that had more and various kinds of drugs in them. They had benzos, they had meth, they had multiple drugs in there, and they also were people that had been using drugs for a longer time. So that's what's happening here, but that's not what's happening all over the country. Okay, next. West Virginia individuals who died with xylazine present have a longer history of drug and alcohol use. So it's just not drugs. Some of them, many of them were taking alcohol. And they also have hepatic diseases or hepatic damage. So they had hepatitis B or C, or they just had liver damage. And hepatitis C is very, very common among individuals that use IV drugs, but it's also just common for people that snort drugs. You can get hepatitis C if when a person shares and snorted fentanyl or cocaine or heroin, and they share that same straw, and they can get hepatitis C. The good news is, if you find any of your individuals that have hepatitis C, you can really get them treatment now much more easily than it was a few years ago. You know, when that they do the hepatitis screen, and if it's positive, it means you might have hepatitis C. Because hepatitis C, 15% of people can beat it on their own. Then you get your viral load, and you get what kind of hepatitis C is. There's actually 6 kinds of hepatitis. And the nice thing is, and you see these advertisements on television all the time, there's 2 medicines now that can treat all hepatitis with just a pill a day. One's for 8 weeks, and one's for 12 weeks. And they both have 98% success rates. So a lot of these people who have hepatitis C, they don't really have any symptoms. They might even know they have hepatitis C. They just say, I feel fine, so I never did anything about it. And they didn't want to get IV drugs, IV medicines for weeks and feel sick. Now they can just get their medicine, take their pill every day, and in 8 to 12 weeks, 98% cure rate. So that's really helpful because untreated hepatitis C makes you much more likely to have liver cancer. Okay, next. Okay. 90% of the opiates tested, this is in Philadelphia, had xylazine present by 2021. You know, big difference between West Virginia and Philadelphia. They have a lot more of this xylazine present. And it's kind of amazing because if you look at the television, you would think this is an inner city problem. And the answer is no, it's a problem for all different groups. You know, these are the people that died with xylazine on board. 64% were white, 17% were black, 15% were Hispanic, and 4% were other. So you can see it's a problem for everybody. Okay, here again, overdose deaths. Over 70% were between the ages of 30 and 59, and over 70% were male. And that is common. People with opiate use disorder are predominantly males. I mean, not 100%, but 2 out of 3. So you often find males that are using different opioids. And sometimes because they did construction work and they got hurt, so they started taking opiates to be able to keep going at work, and then it got worse and worse and worse, and they ended up going to heroin or fentanyl. Okay, next please, I'm going to go, okay. There's no evidence of injection. 84% of overdose deaths with xylazine present. So that's something that's really amazing, isn't it? You know, we think this is a mix with people doing IV drugs. It's not. Fentanyl is so strong, you don't have to use an IV. You can snort it. Or you can even put it in your mouth. That's a good way to end up dead. But it's just, you gotta have people teach them ahead of time that you don't want them to take street drugs anymore. They're just so deadly. Next. And this is one of the things that's changed dramatically across the East Coast. And these are Philadelphia numbers. It used to be just a few years ago. Benzodiazepines, that's the Xanax, the Valium, the Klonopin. That was something that was mixed in with fentanyl or heroin, but normally fentanyl, because those are long-lasting drugs, and so they give you longer-lasting highs. But they're also deadly dangerous because they cause sedation. And if you take 2 medicines that cause sedation, respiratory distress, stop your breathing, you can die. So that has stopped. What's happened is the benzos in the fentanyl has gone down, 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 and the xylazine in the fentanyl has gone up, up, up. And this is this is about the pharmacology. I don't really bore you with it because you're not pharmacists. But again, xylazine is that family with the alpha-2 agonist. So it's chemically similar to clonidine. It's chemically similar to that last one, the Xylazine. That's a brand name, Lucirma. Has anybody ever heard of it? It's actually the only medicine in America that's FDA approved to take away withdrawal symptoms from opioids. Very pricey. It's $2,000 a week. And you can't really get it. Most of the insurance companies don't want to pay for it. And so they don't pay for it. I even had some wealthy patients who said, tell you what, I got money, I'll buy it. They go to the pharmacy says, hey, we're not carrying that. We're going to buy 1,000 pills just to give you 2 weeks worth. We're going to be stuck with all that. So, I mean, it's FDA approved, but it really, you can't get it. And if any of you talk to people that work in rehab facilities, they often give clonidine to help people when they go through withdrawal. Well, there's a European study that says that the Lucirma, the brand name, is only slightly better than clonidine. But since clonidine is $4 a week, and that's $2,000 a week, they say it's not worth it. Okay. Now, this is for anybody who likes charts and graphs. You might like this, but the important thing here is that the one on the right is it blocks these alpha adrenergic sites and it stimulates the sites on the right. So what happens here is you get an abnormal feedback, and so you get the effects like sedation, you get effects like decreased heart rate, decreased blood pressure, and slightly decreased respiratory rate. Not a large decrease, a slight decrease. Okay, next please. Okay, so what can we do to test these people and find this? And as I mentioned, this is a real problem because only recently do we have the test strips. You know, does anybody here have Xylazine test strips for their facility? Oh, you do already. They would be illegal. Yeah, I'm always amazed at those laws. I mean, you have these head shops that have all this stuff that's illegal in there. Nobody goes in there. But if somebody on the street carries this stuff, oh, you're in trouble. But anyway, you know, those are somehow because most of the hospitals don't have the ability to test for xylazine. They have to send them off to reference labs. And reference labs take you a few days and cost a lot of money. And you have to take care of that patient now. Okay? Then we also, you can't find out, you can only, with the test strips, you only have positive and negative. But you can have how much if you send it off to the lab, the reference lab. Again, that takes a lot of time and costs a lot of money. So hopefully hospitals start having the ability to test this at their sites. And then you get the ability to use xylazine test strips. The reason that's important, we'll talk about it later, is when you reverse a fentanyl, you give somebody naloxone. And you give them, nowadays you have to give them a few naloxones because fentanyl is pretty strong. But when they don't wake up, you're concerned, like, well, wait a second, something's wrong here. I gave him the Narcan, he's breathing a little better, but this doesn't seem to go anywhere. He's still not waking up. Well, that probably is a xylazine situation. And there are some studies that say, once you get that person's respirations up and his pulse up normal, you want to stop giving your naloxone, because if if you keep giving more and more, there are instances where people are starting to get severe fentanyl withdrawal symptoms, where they actually had emesis. And if you have emesis when you're unconscious, you normally in real trouble. You're not going to live unless there's somebody there to clear your airways. Now, Xylazine test strips are now, as I mentioned, for $2 each. The maker is a Canadian firm. They're also the same firm that has the lion's share of the fentanyl test strip market. How much did you folks pay for yours? Okay, so I was close. Okay. Now this just shows you the tremendous increase in Xylazine. And hospitals in Philadelphia have started to test for it. So you see the positive and negative there. There's just tremendous increase. Okay? Now Xylazine testing in the hospital. What they found was that those that were positive for Xylazine, 27% were female, 64% were whites, 31% were black. Only 4.6% were Hispanic. And that kind of goes along with what we talked about how, it's common for a lot of the people dying, the number one group dying from these overdoses are whites. But it's happening across the board. The other thing of interest, and we're not sure why this is happening, is the CAL score. Remember CAL score stands for Clinical Opioid Withdrawal Score. Ever heard of that one? Okay. So, people who have more Xylazine in tend to have higher scores in withdrawal. Next, please. So, so how do we, who is using the Xylazine? How does Xylazine impact withdrawal symptoms? Okay. Xylazine seems to make withdrawal symptoms worse, and it seems to make them much, much longer. Okay. What complications are people having? Well, if you're out again for 4 to 8 hours and you're not moving, you can get pressure ulcers. You can get ulcers from not just pressure, but you can get blood clots that can go to your brain, your heart, your lung. But something else happens with Xylazine that they're not sure why it's happening. People get terrible ulcers at their injection sites, but people are getting ulcers and wounds on parts of their body where they did not do the injections. And this is normally just happening in that area from New York down to Washington, D.C. And so it's thought that, nobody knows for sure, but it's thought that maybe the Xylazine concentrations there are greater along that stretch, or maybe there's another contamination agent in there we don't know about causing these ulcers. But the ulcers are more common, not just where they get the injection, but all over the body. And we're going to have some horrific pictures to show you a few minutes here. So this is, they just asked people, they went on social media and they asked people who were using, how were they taking their drugs, and they found that, some were taking intranasal, some injections, some were inhaling, some were taking orally. And the question is, do you seek out Xylazine? And the vast majority of people said no, they don't seek out Xylazine. It just happens to be there. They don't want it to be there. Okay, next please. And this just talks about the results of withdrawal. And as we mentioned before, people that use Xylazine tend to have higher withdrawal scores, and they tend to have longer withdrawals because Xylazine stays in your system a long time. They also ask people, how do you like to withdraw with Xylazine versus it? And most people on the right here side saying it's worse. Things are much worse with xylazine. Now, this is what makes it confusing and why you really do need to test it. When you do see that patient, there's a lot of the same symptoms when you use opioids or benzodiazepines or xylazine. So we have our xylazine, it can cause anxiety, dysphoria, restlessness, and sedation. With opioids, you can see there's the restlessness, body aches, GI symptoms, tremors, yawning, but you also have anxiety and dysphoria. And then the benzos. When a person's coming off of a benzo, they can have anxiety and they can have dysphoria. So it's very confusing. All three of these drugs can have the same symptoms, but the treatment is quite different. Your naloxone is going to help you with your opioids. It's not going to help you with the benzodiazepine, and it's not going to do anything for xylazine. Next one. Okay. Now, this is the problem. The treatment for xylazine withdrawal is all over the place right now. And there's some people that are giving clonidine, trying to replace those receptors with something that's not as strong. Some people, or many people around Philadelphia are giving benzodiazepines. Some are giving antipsychotics. Some are giving phenobarbital, and some are giving gabapentin. I guess the answer to everything in America recently is gabapentin. Everybody's on it. Okay, in the ICU, some people are even giving ketamine. Others that Xylazine is the one that's FDA approved, I believe, for it's an alpha 2 antagonist, I believe. I don't want to mess that up on you. So it's all over the place. You have a West Virginia a paper that was written in the past 6 months, a research paper on this, that said absolutely don't give anybody benzodiazepines. If somebody's already sedated with xylazine, and you give them something else that's sedating, I mean, that's just, you're asking for a disaster. So there you have it. You can find studies that say give benzos and studies that say never give benzos. Okay, next, please. Now, even though naloxone won't reverse xylazine, NID, that's the National Institute for Drug Abuse, says use naloxone on anybody that you know that has xylazine overdoses since fentanyl is normally present. Okay? And xylazine's undesirable side effects like hypotension, bradycardia can be reversed by alpha 2 antagonists. That's like, there's your Humvee. But these are not FDA approved in humans. Both of those are FDA approved in animals. Here's another reversal agent that's FDA approved for animals, Xylazine. It's trained in Xylazine. Okay, this is where I want to have my sister take over because she's had a lot more experience with these wounds than I have. Not just from Xylazine, but from individuals that have that heroin that was laced with feces that caused a lot of terrible skin infections in the hand.